Good evening and welcome to Health Guide, the program that brings you reliable health information to help you make informed decisions about your well being. Today's edition focuses on fibroids to help us understand what fibroids are, what causes them, the available treatment options, and how women can protect themselves from fibroids. In our studios is an experienced gynecologist and the current Bauchi State Chairman of the Nigerian Medical Association, NMA, in the person of Dr. Abdullahi Muhammad Kabir. Doctor, you are welcome to BATV
Thank
Health
you.
Guide, and
Thank
we are
you
glad
very
to
much.
have you. So let's
Thank
begin.
you very
When we
much.
say fibroid, what is fibroid?
Yes. Um, Uterine fibroid, more precisely, because you could have fibroids in other places, but the particular one we are discussing today is uterine fibroid. And it is a growth, to make it simple, arising from the myometrium. When we say myometrium, it's the inner layer of the womb. So to put it simple, it's just a benign. And when we say benign, a benign growth of the womb. When we say benign, it means it's not a cancer. Anything that is growing in the body, it could either be benign or malignant. It is benign when it is not cancer, and it is malignant when it is a cancer. So fibroid is not a cancer. It's just a benign growth arising from the womb, precisely the inner layer of the womb, because womb has three layers: the outer layer, the middle layer, or the inner layer, I have said, and then the middle layer, and then the inner layer. So the inner layer is the muscular layer. That is the fat that contracts during labor, and that is the fat that contracts during menstruation. So when fibroid arise from that, when there is a growth arising from that fat, is called a fibroid. And mostly, because the layer is made up of cells. When we say cells, is the smallest unit of the body. So the cells arising from the myometrium, which is the inner layer, are called myometrial cells or myocytes. So fibroid is a growth, an uncontrolled growth of the cells within the myometrium, within the inner layer of the uterus.
Okay, so how common do we have this condition?
Yes, it's a very common thing that we see in gynecology clinic. If you run a gynae clinic, if you see 10 patients, probably you see like 4 with uterine fibroid. And it is common that such that you see, like in the blacks, we call it a disease of black people, because we have the predilection to have it more than the white people. So you hardly find women that do not have it. So most women will have it. What make it different among those that come with it and those that don't come with it to the clinic is the symptoms. Because a lot of those that will have small ones will not come to the hospital. Mostly we see it during surgeries for other things. Or sometimes incidentally when they go for ultrasound scan for other problems, we see it. But those that come to the hospital are the ones that have symptoms mostly. And actually a good number of our patients that come to the clinic have uterine fibroid. It is common among women that are 30 years and above. And it is also common among women who have not delivered many times for many reasons. Yes. So it's a common thing actually, and a cause of sometimes stay out of work for women, because when they have bleeding, sometimes it can be so much that they cannot even come to stay with people. A cause of pain, especially during menstruation for a lot of women. Those that have uterine fibroid, they tend to have more pains during menstruation. And even sometimes outside menses, when some changes within the fibroid occur, it can cause a lot of pain that can keep women away from their work places, and are also a cause of financial expenditure for a lot of women, because a lot of them will have to go to hospital for surgeries that consumes a lot of resources for the patient. So it's actually a very important condition in gynecology.
Yeah, so you just talk about some of the signs and symptoms that the woman will notice to seek help. But what actually causes this uterine fibroid?
So normally what we say is that the cause of uterine fibroid is unknown. Yes. But there are risk factors. What it means, things that we see in those that have uterine fibroid. Like I started saying, one of the risk factors is advanced age. When a woman is 30 years and above, um, uh, she is at risk of having uterine fibroid. When she is a nullifera is a woman who has not carried pregnancy before to term. So mostly women who have stayed long time without pregnancy, reaching 30 years and above, they are at risk of uterine fibroid, because pregnancy in a way reduce the risk because of the process that leads to the fibroid. When there is pregnancy, like pregnancy halts the process.
Okay.
So and then like reduce the risk for a woman. It is also common among the blacks more than the white people. It is also common among women who they have their first degree relations with the fibroid. Yes, because it has some familial tendency. There are genes, that have been implicated in the disease. When we say genes, these are things that control our beings, our everything we see in us, our color, our height, our whatever. So the genes, there are genes that have been implicated. Some mutations in those genes have led to the development of uterine fibroid. So it means if a family member has that mutation, then the other family member has also risk of having the same mutation, because they are mostly having some genetic resemblance. So it is a common thing among first degree relation that have it. So if a sister has it, the other sister is at increases. In fact, there are situations where you see in a family where fibroid will occur at a much younger age than what we normally see. And mostly it's due to those mutations. You see a sister having, you just finished treating the sister, you see another sister coming with similar thing at earlier age than what is expected. So mainly these are the major things that have been identified among those that have uterine fibroid.
So, late pregnancy, a womb that has not carried. So, can we associate fibroid to infertility? Does it have any link?
Yes, they have link actually. What we normally say is that a woman that has infertility, like I said, means she has not carried pregnancy. So I said pregnancy like halt. Let me break it more clearer. There is a hormone, a female hormone we call estrogen. So that estrogen is believed to be actually very important in development of uterine fibroid. Precisely, we have various estrogen. We are talking about ovarian estrogen. Estrogen arising from the ovaries of a woman. So now, if a woman is pregnant, so let me say, exposure to that estrogen put a woman at risk of having uterine fibroid, prolonged exposure. That is why you will not see in younger, estrogen begin to be produced in a woman from the time she enter puberty, from the time she start menstruating. So now she's exposed to estrogen throughout until when she stops menstruating. So in between the beginning of her menses to the time she will go into menopause, once the exposure is reduced by anything, that reduction, that thing reduces the risk of fibroids. So now, if a woman is pregnant,
Yeah.
there is blockage of production of estrogen from the ovaries.
Okay.
So in a way, you are reducing the exposure of estrogen to the woman. So in a way, you actually reduce the risk of having uterine fibroids. So now, if a woman has infertility, it means she has continuous and prolonged exposure to estrogen, and that put her at increased risk of having uterine fibroid. Yeah, so that is a relationship. So people that have infertility because they have not been pregnant, it means they have continuous exposure to estrogen. They become at risk. Yes.
So can we say, are there some specific lifestyles that put a woman at risk of developing fibroid?
Yeah, sincerely, most lifestyles when we talk about, because the central thing to development of uterine fibroid, other than the genetic tendency, that is a genetic mutation, is exposure to estrogen. So any lifestyle that can put a woman at increased risk of having exposure to estrogen will put her at increased risk of having uterine fibroid. And any lifestyle that will reduce the risk of exposure to estrogen will reduce the risk. So if you look at it now, when you say lifestyle, maybe smoking, smoking will reduce estrogen level. So indirectly, you can say it may even reduce the risk of having uterine fibroid. Maybe alcohol ingestion, maybe exercise and other things. So those things have not been shown to actually reduce estrogen exposure or whatever. So they have not exercise. People have talked about sedentary lifestyle as a risk factor for also uterine fibroid, but that is not a very concrete, or let me say, a very strong association. So alcohol injection is not a risk factor for uterine fibroid. So most lifestyles are not really a problem. The main thing is having age 30 years and above and not carrying a pregnancy. You get it? Yes, and then family, probably being a black woman, because we the blacks, we tend to have that genetic mutation more than the white people. And then having a family history where a sister has a similar problem.
So when should a woman seek medical attention?
Yes, most women will come to the hospital without even being informed to come because of symptoms. So ideally, once a woman has history of heavy menstruation, because uterine fibroid causes heavy bleeding. So once a woman sees her menses is heavy, every month it comes, and it is heavy, coming with clothes. So once you see menses coming with clothes, it means it's heavy. Or a woman menstruates more than 7 days. That is also a prolonged bleeding, which can be caused by uterine fibroid. The other thing I have mentioned is painful menses. That's what we call dysmenorrhea. So a lot of women will have painful menses when they have uterine fibroid. So if a woman has painful menses, she needs to come to the hospital. And then for those that don't come early, when they notice already there is a mass, uh, you see a woman, she's not pregnant, but yet her tummy is becoming big. Some people will begin to suspect whether even she's pregnant or not. A lot of them are not married. So in the society, people will start castigating them as having maybe pregnancy, where they don't know really they have uterine fibroid. So ideally, all these are late presentations. For women who actually seek for care regularly, ideally at least every year you should do a checkup. One of such checkup is ultrasound scan. And once you do ultrasound scan, you should be able to see uterine fibroid. But for those that don't come to hospital for any checkup, that is how they present. They wait until when they have bleeding, hence when there is already swelling. Or some actually after getting married, because it's not big enough to cause all these symptoms. But when they get married, they want to get pregnant, they try conceiving, they could not conceive, they come to hospital. While you are evaluating them for infertility, that is when you notice they have uterine fibroid.
Okay.
Yes.
So what are the treatment options?
Basically three. Yes. It's either what we call um, observation. Yeah, it's a woman that is maybe being evaluated for other conditions, and then incidentally ultrasound scan was done, and then we notice a small fibroid. Such patient doesn't have any symptom like pain, bleeding, or anything, so they don't need any treatment. It's just observation. So every 6 to 12 months, you request for an ultrasound scan to see whether the fibroid is growing or not. That is one. Number two is medical treatment. Medical treatment means use of drugs. We use drugs to control the bleeding. We use drugs to control pain. We also use drugs to shrink the fibroid. The main drugs that are used for shrinking the fibroid is what we call GnRH analogs. These are injections that are given every month or every 3 months, depending on the formulation of the injection. So it shrinks the fibroid. Once it shrinks the fibroid, the symptoms of pain, bleeding reduces, and the size of the fibroid reduces. The only problem with the injection is that once you stop the injection, the fibroid will grow again. Yeah, so mostly we use the injection in patients who are awaiting a long list for surgery so that they have improvement in their symptoms, or in group of patients who are actually not fit even for surgery. You could have a patient that have uterine fibroid, but because of some other medical conditions, maybe she has heart disease, she has something that you are afraid if you take her into the theater, she may have a bad outcome. So such patient, you can manage them with such injections. And also, there are some patients that will tell you, I don't like surgery. Yes, so it's an option for them. And also for those that are close to menopause. You know, I said the fibroid is an estrogen sensitive tumor. It means it needs that estrogen to grow and to actually cause the problems. So if you see a woman has uterine fibroid and she doesn't like surgery and she's close to menopause, you can just give her the injections before she just enter menopause, so that once she enter menopause, the fibroid will naturally shrink even without any treatment. So these are candidates for injection. Now, sometimes also the fibroid can be too big and you want to keep the uterus. So you want to reduce its size before you go for the surgery. You can give the injections as well. So this is the second one. Now the third one, which is surgery, which is the mainstay of treatment of uterine fibroid. We do surgeries for most of our patients because surgery provides the best of results. You know, once you go in and do the surgery, you remove the fibroids and the patient get relief of her symptoms. And the various options for surgeries include removing the fibroid and leaving the uterus. That is done for younger women, those that are less than 40 years, those that are desirous of future fertility. So you keep her uterus and remove the fibroid. And then the second surgery is removing the uterus, what we call, yes, what we call, you remove the fibroid along with the uterus. So we call it total abdominal hysterectomy. So if you do that, it is done mostly for women that have advanced age 40 years and above. people who have already completed their family size, they are not thinking of getting pregnant again. And also for women who have had many surgeries for uterine fibroid, if you do myomectomy, which is the one that you remove the fibroid and leave the uterus, so if the risk in the woman is still there, after like 7, 10 years, she can come down with fibroid again. So if you have done many surgeries and the fibroid is coming back, sometimes we sit down with the patient and tell them, Madam, let's remove this uterus and forget about this again. So these are candidates for total abdominal hysterectomy. And also, we do total abdominal hysterectomy, that's removing the womb and the fibroid, in those that have other issues. Like a woman has uterine fibroid, already you are doing her pap smear screening for cervical cancer, and you notice already there is telltale sign of that on the mouth of the womb, which is the cervix. So you remove the uterus, since you are removing the uterus alongside the cervix, so that way you'll be able to kill two problems with one solution. So these are the various options available. And the surgery too, like the myomectomy and total abdominal hysterectomy, now we have improvements. You can do open surgery or you can do laparoscopic surgery, what we call pinhole surgery, so that you don't have to make big cuts on the abdomen. That looks cosmetically acceptable for women. So these are approaches of doing the surgery. Yes.
So the conversation is going on very well. Maybe because I'm a woman and then feeling what women go through. But finally, as we round up, what advice, what do you have to tell women, especially those of reproductive age?
Yeah, as it relates to uterine fibroid, the advice I will tell women is that once you are 30 years above and you have not delivered before, and you are a black woman, so it's good to actually once in a while do an ultrasound scan of the pelvis to look at the womb and be sure there is no fibroid there. And for those that have it already, I think it's good to go to the hospital. And one key thing that is very important is assessment and proper treatment. The treatment sometimes can come with its own complications, especially when the fibroid is left to stay too long or to become too big. Sometimes even when you have the opportunity to remove only the fibroid and keep the uterus, you may not be able to do it. Imagine removing a whole womb of a woman who has not delivered before in this our environment. That is a bad thing to happen. But when does that happen? Mostly it happens when women don't present early. You understand? So presentation early and having early treatment of the disease prevent all those issues that can come up with uterine fibroid. So this is my advice for women. Thank you very much.
Thank you very much, Dr. Abdullahi Mohammed Kabir, an ONG consultant with the Abubakar Tafawa Balewa University Teaching Hospital, Bauchi, and currently the chairman of the Nigerian Medical Association. Thank you very much for sharing your knowledge and helping us to understand what fibroid is all about. So thank you for coming to
Thank you very much,
BATV Health
Elizabeth.
Guide.
Thank you.
Yeah.
It's my pleasure being with you today.
You're welcome.
Thank you.
So thank you, our viewers. Remember that early diagnosis and prompt medical care can make a significant difference. As a woman of reproductive age, when you experience heavy bleeding or unusual symptoms, please contact a practitioner. Thank you for joining BATV Health Guide. I am your host, Elizabeth Ka, and I look forward to seeing you again in our subsequent editions. Thank you and God bless.
Thank you.